Thank you, Mr. President, and thank both of you. I know you've been working round the clock. You have been extraordinarily responsive and have demonstrated outstanding leadership through an unprecedented time. All the tests and all the preparation to prepare us for moments like this have prepared us as best we can. Right. And so we've been able to enact procedures for moments precise like this. And I think our local jurisdiction has been better prepared than many others because of that preparation and because of your leadership. And by extension, I want to also acknowledge and thank the entire Department of Health and Human Services, all the county agencies, especially our first responders. And the term first responder now casts a very wide net. Our first responders include our frontline medical staff, staffing our hospitals and our medical care facilities. Our frontline responders include the staff at our grocery stores and supermarkets and pharmacies. Our first responders are all of us right now, because we all in our county have a role to play to ensure our own health and wellness and that of our families and neighbors, but our entire community. And it's times like this where you realize that our spirit has been tested. But I have been so impressed at the outstanding leadership of our private sector as well, who has come forward in offering their assistance and help. When the federal government stubs its toe, local jurisdictions limp. And the federal government has done much more, unfortunately, than stub its toe. The mixed messages and the incredible frustration and the delay in the implementation of much necessary strategies have left all of us in a weakened position. And so I want to acknowledge that you are feeling the brunt of that and want to underscore and appreciate and respect the frustration you're feeling with that response, but let our communities know that we're doing everything humanly possible to overcome what has been challenges that should have been addressed earlier, but that we are working through right now. So I did have a few questions and comments based both on constituent requests that have come in, and all of us are fielding just numerous constituent requests and feeling the frustration of our community and the exasperation and the anxiety that everybody's feeling right now, especially because we don't know exactly when this will phase out and when we will be able to move forward with business entirely as usual. But my first question does relate to testing. I don't want to reiterate what was said before, but as more tests become available, clearly the first wave needs to go to those patients who are the most at risk, and then as we extend that out. But as tests become available, are we prioritizing those first responders in addition to our traditional first responders, fire and rescue and law enforcement, but also medical personnel, nonprofit organizations, and those people who, by virtue of their work, are essential and must continue to interact, especially with vulnerable populations?
So the short answer is yes, but it's consistent within the criteria that have been laid out, is making sure that individuals, particularly those who are ill and have demonstrated symptoms, are tested first. And so hopefully we may get to the point where we are at just general testing for the general population. I think that in the absence of testing, there are a number of good strategies in place to make sure that we minimize risk of exposure to frontline, however you define it. So, for example, there are specific algorithms in place if you are a healthcare provider who is exposed to an individual who is confirmed case or highly suspicious and pending test results. So there's different strategies put in place to address a lot of those different situations. I think the ability to be able to expand that testing to individuals who are asymptomatic and don't have a known exposure is in large part driven by the ultimate capacity that we have once we scale things up.
Thank you.
I would only add that, and I agree with everything you said about the testing, and we feel like we're fighting in the dark on a lot of those things. I did not expect to be thinking about whether we consider things like non-FDA approved testing capabilities and other things like that, but that's where we're at. Wow. We're having those conversations because we've been, hey, it'll come tomorrow for 2 weeks. And so we did not ever envision ourselves as being in this kind of situation where we would be looking at things like that, tests that are approved in other countries but not in the United States. We are considering all those options because we agree that we would be much more capable of responding to this event if we had much better testing capabilities. Now, obviously, we've got to, we are essentially having to do some of the data analysis ourselves, the role the FDA should be playing to make these decisions. And we're in some really strange times as far as that goes. But I mean, I hear directly from first responders on a regular basis. We're working closely with them, and we agree that all the things you raised we agree with. Obviously right now, the first test will go towards where there will be a clinical difference in us testing you positive or negative. That's really the key. Where there's a decision where there would be, life and death is decided by whether we test somebody. But certainly, take an example. So if we have to take, we did have a law enforcement officer who did confirm positive, and then have a number of people quarantined. As a result of that, if I could test those people a week or 10 days in and clear them and get them back in service sooner, that's a benefit to our first responder community, obviously. But using a test to do that right now when there are people who are clinically very ill and need that test more is not something we can strategically do, and it would not make good sense for us to do that. I would like to get to that place where we could do some testing and clear our first responders, give them the peace of mind with their families, all of those things. We've certainly talked a lot about how we would do that once we have kits available, but until we have something that we can rely on, we can't implement something like that.
I appreciate that. And obviously, as they become available, we'll prioritize the groups that need them most, but wanted to get that out because we've been getting lots of questions from those organizations. Second, I know the coordination with the state is critical. I couldn't help but notice that the test sites did not include Montgomery County, although we have the most number of cases and the largest population. And let me just say for the public at large, we have over 130,000 residents that are over the age of 65 in Montgomery County. So as we talk about things like surge capacity and 167 ventilators available to the entire county, clearly there needs to be coordination in terms of prioritization. I know that we are working closely with our colleagues at the state level, and we have to continue that strong relationship. And I know from past calls we have indicated that we would certainly appreciate being a location. But if you could comment as much as you can on what those deliberations and discussions have been like with the state, and is there more that we need to do to reinforce that Montgomery County also needs a large capacity test facility as well?
So I can speak from the testing capacity and the public health capacity. So the things that you just mentioned those messages have been relayed to Baltimore and to Annapolis, and we've engaged in strategies to how to improve the testing capacity here. And as a result of those conversations, that's where we're talking about potentially utilizing our emission centers as spaces. So that was heard very clearly. And I am hopeful that the future conversations will take that into consideration.
I would only add that a couple things. Our colleagues at the state are working very hard too, and I think I want to make sure that's well recognized. They're making a lot of hard choices and decisions. And generally speaking, I've had a very close collaboration with my counterpart at the state for emergency management. I texted him today; he texted me back. They've been very communicative about what the realities they're facing. Now, there are certainly cases where we would like them to take more aggressive action. Surge is probably one of those. They put together a task force to look at surge at a time when I thought a task force did not lend itself to a task force model, and they need to be more aggressive in doing things, even if it meant we were going to. We always want more information to make the best decisions, but sometimes you have to act absent the most concrete information available. That you have to act with what you have in front of you, because the delay in not acting is worse than the misallocation of resources that you may face. And so I would certainly agree with the sentiment that we have to work with the state to the extent that we can, but we have to be willing to move beyond where the state is in a timely manner to protect our residents.
And we're definitely there. I mean, the surge planning is evidence of that, and we're not. The definition of insanity is doing the same thing over and over again, expecting different outcome, waiting for the feds to step up. That they're just not. So we're not waiting for that to happen, and we're being very strategic and thoughtful, though, about how we can work with the state to get those resources. And I remain optimistic because, as Earl pointed out, they're working really hard. They've been very transparent with us in the relationship and talking, and hopefully that produces some results shortly.
And Dr. Haft from the state is planning to be on our call today with the hospital CEOs, I believe.
He won't be able to make it, but he's part of the conversation.
Okay, good. Okay. So we've certainly reached, we don't want to have a conversation absent the state, but if the state's not moving forward in a way that we think is responsible to our residents, we have to move forward without them.
Thank you. Another population we've received messages from that feels on some level left out, would like some specialized level of communication is our disability community, particularly as it relates to testing. To Councilmember Jawando's point earlier, we have certain populations that are just less mobile. And so as we develop plans, if we could more clearly articulate those through our Commission for the People with Disabilities and other channels, that is a message that I was asked to deliver, and an important one, clearly. And likewise, I appreciate the administration's efforts recently to ramp up and be more strategic in the way that we're reaching multicultural populations. And I certainly have seen improvement. But that remains something that we need to do even better. There was a press release that went out yesterday in Spanish that had a number of grammatical errors, and there are also still phone numbers being publicized and promoted in multilingual communities, but that don't have the infrastructure for multilingual responses. And so if we promote a number, we have to double and triple check that that number is available, or at least has a plan to be able to, in real time, respond to the questions of residents. And we're going to continue to push for that, and we'll talk offline about some future strategies moving forward that I've spoken to Councilmember Navarro about. And I guess, the next wave of this discussion is going to be the surge capacity, as we've alluded to earlier. And so I will be following up both as chair of HHS, but also in general, about the capacity of hospitals moving forward. The governor of New York this morning was profound and articulate in just letting the entire country know that they are the canary in the coal mine, that what is happening to them is likely going to happen to the rest of the country. And so just like Italy. And so I think that, to the degree to which we can be more proactive in that space, and the council stands ready to appropriate funds as necessary and to be able to move this forward, because as Councilmember Reamer said, we cannot wait. Thank you both very much.